Hi, this is Pam from Your Nurse Advocate Consulting. Welcome to another Tuesday Tips. I am glad to be here. Welcome to those that are joining us live, and also thanks for catching us if you are not able to join us live and you're catching the replay. So we are getting into the month of March, and a couple of things we just did last week. We kind of did an overview of the top senior care trends for 2025. Over the next few weeks, we're going to delve into those a little bit more. Just as a reminder, I want to remind everyone tomorrow, which is March 12th, is our first webinar for siblings, pulling your siblings together to care for aging parents. We're going to talk about 3 areas. We're going to talk about family communication, working with your siblings. We're going to talk about getting your affairs in order, and we're going to talk about navigating the healthcare system, knowing just what your aging family members need and how to find the appropriate resources. So when we're done, I will drop the link in there, but we do have that starts tomorrow, and you'll be able to choose one of 3 dates for that masterclass. So let's get started for today's Tuesday tips. So the top senior care trend that we talked about last week was about senior housing. And in 5 years, every single baby boomer is going to be 65 years of age or older. And one of the trends for housing is that there aren't a lot of baby boomers that are prepared and ready to pay for assisted living or pay for a nursing home. A lot of people, and we'll talk about this more, is going to lead them to aging in place. So today we're going to talk a little bit about how do you go about, what does it cost to go in assisted living? What does it cost to go in a nursing home? If you can't afford those 2 things, what are some of your options? So the first thing that's really most important, I want to get out in the open right now, is it is very, very extremely important to have the conversation now. Even if you don't think, your parents are doing fine, this might be years away, now's the time to have the conversation. Hey, mom, hey, dad, when the time comes when maybe you're not able to care for yourself at home, or things become unsafe, maybe they won't, but in case they do, where would you be willing to go? Would you be willing to go into an assisted living or a senior, community, a senior independent apartment? Or if you no longer can stay at home, or if you need, ongoing care, would you be, willing to go to a nursing home? So by having these conversations, early and soon enough, people can plan, families and your aging loved ones can plan to be able to afford whatever type of living choice that they've decided on. And I always, even if the answer is I want to age in place, always have the plan B. We never know what tomorrow brings, and we hope that we can all age well and stay in our homes and be able to care for ourselves or have our needs met at home. But if not, what is the plan B, just in case? So we encourage everyone to start those conversations. And so we're going to talk about 3 levels of care on this Tuesday Tips. We're going to talk about assisted livings. We're going to talk about nursing homes. And we're also going to talk about home health. There was, it was interesting. I was looking at a Massachusetts big area, big hospital. They actually have a team of doctors and nurses and that provide hospital care in the home. So in big, large metropolitan areas, that might, be an option for you depending on where you live. But there are going to be more seniors than there's going to be senior living. The hospitals are overcrowded in these big metropolitan areas. That beds are of a shortage. People have been known, I've heard stories that people are sitting in some areas 2-3 days in the emergency room because there's no beds in the hospital. So, we kind of thought some of these things would go away after COVID, but they really haven't. So it's so much more important, now than ever, to plan ahead. So let's look at assisted livings. Assisted livings, depending on where you live and what kind of amenities you like, what kind of atmosphere you like, assisted livings can run anywhere from $3,500 to $7,000 a month, depending on the amount of services that you need and the aesthetics, the atmosphere, and all those kind of things. I will say that assisted livings, because there's a shortage of nursing home beds and staff workers in assisted living, there's also, what they call enhanced care. Now, they're actually in some assisted livings able to take people that are requiring a two-person transfer or a mechanical lift, such as a Hoyer lift, some mechanical device to transfer them out of the bed. So a few years ago, you didn't hear of those kind of services at assisted living. But the caveat with assisted living is predominantly private pay. And what does that mean? That means you pay out of your pocket. That means Medicare doesn't cover it, Medicaid doesn't cover it. Now, in some instances, Medicaid will cover it, but it's at a lesser rate than their private pay rate. So a lot of assisted livings, they will require you to spend X amount of months at a private pay rate before they would allow to keep you and flip you over to a Medicaid payment. Once you've spent all of your money on your housing and need to go to Medicaid, they want you to be able to pay privately for some time before you flip, so to speak. Nursing home is never covered by insurance or Medicare unless you are there for short-term rehab. If the plan is 100 and 120 days, and usually the first 20 days by Medicare or a Medicare Advantage plan is paid at 100%. Then for the remaining days, the remaining 100 days is paid at 80% usually, and a private pay of 20% copay. Now, sometimes you may have extra Medicare insurance that may cover those copays, but it's not going to pay past 120 days. And if your care is determined as custodial care, which means you're going to need care for the rest of your life, and that's ongoing, and you're not expected to improve as far as being able to take care of yourself, that is always going to be private pay or Medicaid. And the private pay, for a nursing home level of care, can it be anywhere from $6,000 to $9,000 to $10,000 a month, depending on where you live and the types of care that you need. So very expensive, and you can see where someone's retirement, could run out very quickly. But that is considered one of the top trends for 2025 is how do we provide housing and care for all of these aging adults, and how can it be affordable? We know it's already not affordable. So how do we deal with that? So one of the things then is leading to another trend, which is, aging in place. And so in order to age in place, what happens, how do you get your needs met? And one of the things, before we move into aging in place, I wanted to share a website with you. This is called Medicare Compare for nursing homes. We have had recent clients where, not by our choice, but by default, one of our clients ended up in a nursing home that had a very poor quality. They're a 5-star rating system that Medicare has. They rate on quality, they rate on staffing, and they rate on complaints and just overall how their quality programs are run, and which takes into consideration complaints and things like that is received by the state for that particular nursing home. So when you go to this Medicare Compare, and this is the website for the nursing home. So I'll bring that up on the screen, and it should be in the comments as well on our Facebook page. But this is the website where you would go, and you can actually put in your zip code. It brings up the nursing homes in your area, and you can actually look at the 5-star rating. And then when you click on that, it actually tells you what star rating they have for quality, for staffing, and then also for overall how they do as far as complaints, and their customer service satisfaction is what I'm getting at. So customer service satisfaction, quality satisfaction, and also their quality, customer service, and the staffing. So those are the things that go into measuring the Medicare Compare and how they judge and assign a quality score to a nursing home. So you can look at those. We had one that ended up in a 1-star facility, and I could not get her out of there fast enough. It was a horrible experience. The care was not very good. And so that's why they have these. So be an educated consumer. And if your loved one is needing to go to rehab or nursing home, please check out the Medicare Compare and look at the scores. There is not a Medicare Compare score for assisted livings because they do not fall under Medicare regulations as far as they are by the federal government. Now, there are state surveys. The state comes in and they have to review and license assisted livings, but they don't have the federal jurisdiction such as nursing homes do. So there is not a Medicare Compare for assisted livings, but you can certainly look at their ratings, talk to friends and family, talk to people who have been there, or have had loved ones or family members in there. So try and get the information that you can and interview them. When you go for a tour in assisted livings, we do have on our website under free resources, there is a guide, so to speak, and a checklist for looking at assisted livings, what to look for, what to ask, interview them. What is their staffing ratio? How many patients or how many residents per caregiver? How many caregivers do they have at nighttime? If they have at least 2 at night, I mean, that's good. Sometimes they'll have only 1 care staff at night, depending on the acuity or how many patients or how many residents are in the community. So lots of things to ask. Can they accommodate special meals? If your loved one is a diabetic, how do they make sure that they're getting in the proper diet that's ordered by the physician? So lots of things to consider, but that is a free resource for you that you can get on our website under the tab free resources. Now, moving into aging in place. So what if moving into a nursing home or moving into assisted living is really not an option? What are some of the things that we can do to be safe at home for as long as possible? So your aging loved ones, there is skilled home health care, which means you have to have been in the hospital, or if you haven't been in the hospital, you have to have a condition change. You have to see the doctor. The doctor has to write an order for skilled home health care. And that's called what they call a face-to-face. The doctor actually has to see the patient before they can recommend and write an order for home health. Skilled home health is nurses, social workers, physical therapy, occupational therapy, speech therapy, and home health aid. And so you can get some help. But what people don't understand about home health care, it's what we call episodic, which means it's short term, and intermittent, which means they don't come every day. They may come 2 or 3 times a week. You may get a bath aide to come in twice a week, but they're not going to be spending hours with you. Each time someone comes, they may spend only 30 to 45 minutes up to an hour, and then they're done until the next time they come. So it's not an answer for those of you that maybe are in the sandwich generation. You're working or you have a business and you can't be home all the time. Skilled home health is not going to give you that kind of coverage. And that's when you get into non-medical home care, which is private pay. And so there are some instances where if you qualify for Medicaid through your county aging and disability resource center, your county agent, your government agency on aging may be able to qualify you for Medicaid services. And if so, then you may be able to be entitled to some services at a reduced cost or free. So lots of things to consider when you're looking at housing trends for senior care. And again, with those baby boomers all turning 65 in the next 5 years, there's going to be a lot of aging adults that are needing services and needing care. So we're going to continue to chip away at that. If for any reason you are in a situation where you find yourself lost in the healthcare system, you've got a situation where your aging loved one, you don't know what to do or how to reach out or how to put a plan in place, That is what we are here for. We give everyone a free 30-minute consultation. We listen to what's going on. We give you at least 2 or 3 action items that you can walk away with, whether you utilize our services or not. And if so, we go to work with you. We can virtually attend doctor's appointments. People put us on speakerphone. I had one today. I had a urologist said, I've never heard of a nurse advocate. And after the doctor visit and after, our conversation and asking questions, he said, my goodness, he says, this is the greatest idea. He says, I am really liking this whole nurse advocate idea. So, this is all new, but know that we are there. We are a resource. You don't have to go through this by yourself, and we will help come alongside you with as little or as much support as you need. So again, just reach out if you need to, and when we can do that free consultation and just hear your story and see if we can help you with your needs. So with that being said, we're going to go ahead and wrap it up for this week's Tuesday Tips, and we'll see you back here next Tuesday for another session. All right, take care. We'll see you soon.